Now for schizophrenia. For the pathophysiology, this includes an abnormal, scattered pattern of thinking for about 6 months or more. It often starts to affect relationships as well as school and workflow, as clients cannot concentrate. So the memory trick, think of the 3 S's. S for schizophrenia, S for scattered pattern of thinking, and S for suicide risk that is high. Now for the causes and risk factors, genetics plays a huge role. So if a parent has schizophrenia, then the children are more likely to have it too. And it's thought to be caused by a decrease in dopamine within the brain. Now for the signs and symptoms, this varies from patient to patient, but there are 3 main categories to know for your exams. Number 1 is positive symptoms. This is known as psychotic symptoms. So the big ones to write down: hallucinations, delusions, and thought disturbance. The second big category is negative symptoms, or a negative state, where the client shows lack of emotions and facial expressions. And the third is cognitive symptoms, or capacity of memory. Clients have difficulty understanding and learning new things. So let's dive in and break these down one by one. First up is positive symptoms. Think P for positive symptoms as P for psychotic symptoms. So hallucinations. This is where clients hear or see things that are not there, like voices in their head or seeing objects. Now there are tactile hallucinations, where we have a sensation of being touched. Second is auditory hallucinations. Clients start hearing voices and sounds that are not there. So the best action by the staff is to provide earphones and music. Huge NCLEX tip. Be sure to write this down. Or even watching TV, which makes it easier to ignore the internal sounds, as it can take a while for the antipsychotic medications to kick in. So don't get tricked here. Audio stimulation is best for the voices in the head, not reading a book or even simply just telling the client to ignore it. So Hesse mentions hearing voices that tell him or her to stay home. These are positive symptoms of schizophrenia. Now delusions, these are false beliefs that the client feels very strongly about, and they won't change their mind even though they know it's false. For example, delusions of reference. This song has a secret message just for me. Big NCLEX tip. So clients will state this, feeling that songs or even TV shows or news articles are a personal message to them. And delusions of control, a client might state, "I do not go online. That's how the FBI controls you." Or delusions of grandeur. "I have a very important meeting with the Queen today." And lastly, persecutory or paranoid delusions. "The hospital food is trying to poison me." Now you can agree that the hospital food isn't that great, but the client believes that they're being persecuted, for example, being poisoned, followed, attacked, or even spied on. So Hesse mentions schizophrenia, positive symptom, delusions. And very lastly, disorganized speech and thought is our third positive symptom category. So let's identify and recognize the different types of thought disturbances. Number 1 is loose associations. We have flight of ideas, basically a rapid shift of thought with no logical connection. Big NCLEX tip, so write these next ones down. The universe is like a raisin, but the moon is a home and I rode my bike. You see, there's no logical connection and we're just jumping from idea to idea. And Saunders mentions, glass breaks if you throw stones. My cousin shoots guns. I live in glass houses. Now, number 2 is neologisms, made up imaginary words. For example, Hesse mentions, "I have to get away. The Vomers are coming to execute me." You see, Vomers is a made-up word. Number 3 is clang associations, listing rhyming words together that make no sense. For example, "Let's go to the bay, let's hit the hay. What do you say? We can go today." All these words rhyme together, but don't make any sense. And number 4 is the word salad, mixing words together that have no meaning except to the client. "Here is the chair, moon orange, drank too much." You see, all the words are mixed together, kind of like a salad. So hence the name word salad. Now, number 5 is concrete thinking. taking a statement literally. So for example, the grass is greener on the other side. Or you might have even heard the saying, don't put all your eggs in one basket. Well, the clients think that there's actual grass or that there's actual eggs. And number 6 is tangentiality, speaking of unrelated topics that do not correlate to the main discussion. So the nurse asks, how do you sleep? And the client says, when I was 5, my cat was killed. I love dogs. You see, these are unrelated topics. And number 7 is echolalia or echolalia, repeating of words they hear from someone else, kind of like an echo. So the nurse says, we will take your vitals. And the client repeats this phrase over and over, like, we'll take your vitals, 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 vitals. So think of an echo, 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 like when you yell and hear an echo, for echolalia or echolalia. Now, number 8 is preservation, repeating the same words or phrases when answering different questions. So the nurse says, how do you feel today? And the client says, absolutely splendid. And the nurse says, do you know today's date? And the client says again, absolutely splendid. So it's pretty different than echolalia in that the client is using their own word over and over again, and they're not echoing someone else's phrase. Now, switching gears to negative symptoms, we see a decrease in emotions and a loss of interest. Sort of like the client is being turned off like a light switch, or in a negative state with negative symptoms. So just think of the 5 A's for negative symptoms. The first A is for an affect that is flat, that is expressionless, or even a blank look, as Saunders mentions. And the second A is for anhedonia, the inability to experience pleasure. So just think the negative symptom. The client is being turned off like that light switch. The third A is for apathy or evolution, the lack of interest or motivation. And the fourth A is allogia, also called elogia, where we have poor speech. And the last A, number 5, is anxiety and avoids social interaction. Now this one is the one to know for your NCLEX, so write this one down. Clients often become anxious when other people are around and prefer to be alone to get relief. It's a negative symptom that keeps the client from forming personal relationships and even social interaction. So really, the one to know, write it down again, is anxiety and avoids social interaction. So ATI mentions negative symptoms, anhedonia, and a blunt affect, or that flat affect. And Hesse mentions what is not a positive symptom of schizophrenia, affective that is flattening. Yes, this is considered a negative symptom. And Saunders mentions negative symptoms associated with schizophrenia. Select all that apply. Verbal communication is almost non-existent, and the client needs frequent redirection because of a short attention span. Now for a top missed NCLEX question. The client with schizophrenia leaves the room as soon as the nurse enters and asks about the client's day. What's the best nursing action? Let the client leave and sit quietly. Yeah, just sit down and be quiet. Now I know this sounds weird, but this is the best way to slowly earn the client's trust by sort of frequently making contact and accepting the client's free decision to go where they please. So don't let the NCLEX trick you here. Don't try and stop the client, and don't follow the client or even ask where the client's going. All these are non-therapeutic and will cause more anxiety and even more paranoia in the schizophrenic patient. So Hesse mentions a client newly admitted with schizophrenia and appears to be in a stupor. What is the best nursing action? Calmly sit with the client in 5-minute intervals. Yes, short, frequent contacts. This builds trust. And a nursing diagnosis, a patient experiencing schizophrenia with negative symptoms. The best nursing diagnosis is social isolation related to withdrawal and reduced communication with others. And lastly, Kaplan mentions a client with schizophrenia, the paranoid type. The nurse evaluates the readiness of the client for participation in unit group activities. Which situation indicates readiness? The client plays a game with the nurse and one other client. Yes, short, frequent contacts build trust. Now for our last big symptom category, we have cognitive symptoms. This affects memory, learning, and understanding. So the memory trick, think of the double C's. C for cognitive symptoms, C for the capacity to remember. Now another thing that is really not tested, but we included anyways, are the 3 phases. Prodromal, we have withdrawn socially. Active, which are extreme symptoms of delusions, hallucinations, and the like. And residual, which are cognitive symptoms. But again, I wouldn't focus on this too much as it wasn't commonly tested. Now a little side note for what is commonly tested. Big key term right here, so write this down. Catatonic schizophrenia. The usual schizophrenia signs and symptoms, they have 2 or more features, so write it down. Immobility, or basically the patient remains in a fixed position for extended time. Bizarre posturing, rigid body positioning. Or mute, the client has no speech. Or severe negativism and refuses to listen to instructions. Or the client is just staring off into space. Now the priority here is fluid and nutritional intake. Huge NCLEX tip, as these clients are at high risk for dehydration and malnutrition. Some clients even need total body care due to the lack of mobility. Now, physiological needs always take priority over social and even psychiatric needs, like verbal communication. So don't let the NCLEX trick you here. Fluid and nutritional intake are priority, since it follows Maslow's hierarchy of needs. So ATI mentions catatonia with catalepsy. Which of the following findings should the nurse expect? Muscle rigidity. Yes, for catatonic schizophrenia, you have to think bizarre posturing and even immobility with muscle rigidity. Now, switching gears to paranoid schizophrenia. The key term to know is persecutory delusions, also called paranoid delusions. Clients think they're being persecuted. A very common example on exams and the NCLEX is thinking that the client's food is being poisoned, or that the client is being followed or attacked and even spied on by the government or FBI. So these clients are really paranoid. So the plan of care, huge NCLEX tips. I would write these down. Number 1, focus on reality and reinforce it verbally. And number 2, acknowledge the client's feelings. So don't get tricked. Do not focus on the delusions. Focus on reality. And do not discredit the delusion, or don't even argue about it or attempt to explore the meaning of the delusion. Again, focus on reality and the client's feelings. For example, therapeutic response, as mentioned by Hesse, is, I understand that the voices are very real to you, but I do not hear them. Now, this response is very therapeutic because it follows those 2 key points. It focuses on reality and it acknowledges the client's feelings. And Kaplan mentions, that must be an unpleasant experience for you. Have you had these feelings before? And Saunders says, facilitate awareness that hallucination is not the reality of the world. So again, we want to focus on reality, reinforce it, and acknowledge the client's feelings. Now, switching gears to therapeutic communication. This is always the most tricky questions on exams and even the NCLEX. Now, we have a full video on therapeutic communication in our mastery course, but let's deep dive specifically for our schizophrenic patients. So first things first, assessment. We always ask open-ended questions, especially when clients are having delusions that people are trying to hurt them. So open-ended questions are basically any question that doesn't end with a yes or no answer. So for example, what are the voices saying to you and what do you see? This actually was an NCLEX question, so I'd write this one down. You see how this question is open-ended. It doesn't end with a yes or no answer. It deeps dive into a deep assessment. So Hesse mentions, tell me what you're feeling at this moment. Describe what you are seeing now. You see how deep we're going into this assessment. And Kaplan mentions, how does it feel to think you are being watched? And ATI, what activities did you enjoy in the past? See how each question is an assessment. So to help you put into more context for an exam question, let's do a Kaplan full question. Do you see those cameras in the ceiling? I'm being watched all the time. Which response by the nurse is most appropriate? Those are the sprinklers in the ceiling that come on if there's a fire. How does it feel to think you are being watched? Yes, this presents reality and acknowledges feelings. Next, we always state the facts. To build trust, we present reality. And to show you acknowledge the client's feelings. Huge. So, for example, I see you're frightened. Let's go to your room and talk about this. Huge NCLEX tip. This actually came up on a few questions during our NCLEX review. Now, Saunders mentions, it might be frightening to think that others want to hurt you. So, we are acknowledging the client's feelings. And Kaplan, I don't hear any voices, but I know they are scary for you. So yes, this states the facts and acknowledges the client's feelings. And Hesse, I understand the voices are real to you, but I do not hear them. Or you see yourself as the savior. I see you as my client. Now, as you can see, all these statements state the facts and acknowledge the client's feelings. So to help you a little bit further, let's see all these statements in action here. Hesse mentions, a client with paranoid schizophrenia refuses food, stating the voices are saying the food is contaminated and deadly. A therapeutic response for the nurse would be, I understand that the voices are real to you, but I do not hear them. And a Kaplan question. There are really strange people in the corner of my room laughing at me and saying horrible things. Which response by the nurse is best? I don't hear any voices, but I know it's frightening to you. Now, switching gears to interventions. We always provide a safe and structured environment and promote trust. And then decrease environmental stimuli and always monitor for suicide risk. So for delusions and hallucinations, I would write these down. Never label the voices or argue with the client about the voices. Always present reality and tell them that you don't hear any voices, but they may seem real to the client. This is therapeutic communication. Now, in terms of pharmacology, we can always use the good old antipsychotics. So the top 4 to know for your exams is haloperidol, brand name Haldol, clozapine, risperidone, as well as ziprasidone, brand name Geodon. So take some notes. We're going to be covering all the top tested key points from our pharmacology master course. Now, the indication is for schizophrenia and Tourette's to control the motor movement. It may be given together with short-acting benzodiazepines like lorazepam to control aggressive behavior. Now, common side effects that are normal are the dystonic behavior found in extrapyramidal symptoms, or EPS. So dystonia, or basically spasms and muscle contractions of the neck and face and tongue, guys, these are not life-threatening, so there's no need to report to the HCP. Now, the big key point here and the killer adverse effect, write this down, NMS, neuroleptic malignant syndrome. Now, guys, this is a huge life-threatening condition. Basically, it's a potential life-threatening reaction most often seen with typical antipsychotics like haloperidol. So think HAL-neuro for haloperidol and neuroleptic malignant syndrome. Now, the key signs to look for, write these down. High fever and diaphoresis, or basically sweating, change in mental status, muscle rigidity, as well as tremors. Now, the priority action here is to hold the haloperidol, assess the patient, and immediately notify the HCP. So do not wait 30 minutes, guys. Don't document. Notify the HCP immediately. Now, the NCLEX will try and trick you, so don't get tricked. NMS is a complication of haloperidol and not of hydrochlorothiazide. Now, thiazide and hydrochlorothiazide indicates that it's a diuretic. This was a very commonly chosen distractor on a lot of question banks. All right, now pump those NCLEX brakes. Here are some top tested questions on NMS, neuroleptic malignant syndrome. ATI mentions a client prescribed multiple antipsychotic medications has rigid extremities, key term, hypertension, another big key term, hyperpyrexia, and diaphoresis. Neuroleptic malignant syndrome, that NMS. So once again, the key terms are rigid extremities, or hyperreflexia, and hypertension. And another question, antipsychotic medications, further teaching is necessary. I should not be concerned about a fever or muscle stiffness. No, you should definitely be concerned on antipsychotics. Now, Kaplan mentions haloperidol 5 milligrams twice a day. The nurse observes the client for which symptoms? Dizziness and lightheadedness, muscle spasms, and stiffness. And Hesse mentions antipsychotic medications for the past 3 days with increased blood pressure, that hypertension, and temperature, and demonstrates muscle rigidity. Which action? Take the client's vitals and notify the healthcare provider, the HCP, immediately. Now let's cover the second generation atypical antipsychotics. We have clozapine and risperidone. Now again, the indication is for schizophrenia and schizoaffective disorders, specifically in clients that have not responded to other antipsychotics. Now some common side effects which no need to report. We have weight gain, so we teach clients about weight management, and also hypersalivation, or basically drooling. And a big one here is sedation, but it usually improves with increased tolerance. Now the major side effects, guys, to write down: agranulocytosis, or basically low WBCs and low immunity, aka leukopenia and decreased neutrophils. So just think that we get increased infection. And the memory trick here is clozapine zaps those WBCs. So key points to write down here: sore throat, fever, and flu-like symptoms. Guys, the priority action, immediately report to the HCP. Now lastly, a big contraindication is patients with dementia. So we never give clozapine, which will actually increase mortality in dementia patients. So guys, a big Hesse question was, which med order for dementia requires intervention by the nurse? And the answer was risperidone. So guys, remember, risperidone we remove from dementia with risperidone or risperidone. Okay, now for some top tested questions from our top quiz banks. The big NCLEX question to know is clozapine, priority to monitor, complete blood count, and absolute neutrophil count, those white blood cells. And Hesse mentions, a client is prescribed clozapine. Which should the nurse monitor? A total white blood cell count. And Saunders, clozapine for schizophrenic disorder. Adverse reaction to the medication if abnormalities are noted on which laboratory study? White blood cell count. And lastly, ATI. A nurse is reviewing the laboratory findings of 4 clients who have schizophrenia, taking clozapine. Priority for the nurse to report: a client who has a WBC count of 2,900. Yes, anything less than 5,000 is abnormal, a decreased neutrophil count. And very lastly, let's review ziprasidone from our pharmacology master course. The indication is for bipolar mania or acute psychosis with agitation. Now the major adverse effects are seizures, but cardiac issues are more common. So guys, big key point here: hypotension, and we monitor for widened QT intervals, which can lead to cardiac arrest and then death. So monitor the ECG and BP closely. And the memory trick here is ziprasidone or ziprasidone. So it's done prolonged your QT waves and done dropped your blood pressure. So that's how you remember it. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor. See you guys in the next videos.